Even from Dr. Lakshmi's,
Yeah,
Dr.
Dr.
Lakshmi's center
Lakshmi, Dr.
also,
Ritika, and Dr. Meenu. Only
yeah,
Dr. Sarapreet
Dr.
is yet to
Sarapreet
join.
sir has to join.
And of course, Dr. Loveleen.
Yes. Dr. Loveleen has joined. Hi, Loveleen ma'am. Good afternoon.
Good afternoon.
Sir, Meenu,
Yes, ma'am.
what about Pankaj sir? Shall we remind
I've
him?
sent a reminder through Farah and Mohit.
Okay.
Sir should be joining.
Okay.
And Shweta ma'am, I had messaged her and she said I'll try and join, though I'll be in my OPD.
Okay.
Dr. Sarapreet is the only one who has not responded. So
बता अभी अच्छा बस और कहाँ पर है हम दिखाते हैं ना सेकंड जगह कहाँ डाला है उसको भी हाय हाउ आर यू हाय मीनू हाय बिंदु मैम
good afternoon,
Hello.
sir.
Good afternoon,
Good
sir.
afternoon,
sir. Good afternoon, sir.
Hi,
Good
good
afternoon,
afternoon.
Yeah, Dr. Sarapreet
Great.
is also here.
Hi ma'am, how are you?
Okay,
How are you?
okay. He's also here. Right.
हाँ जी, मीनू, how are you?
Afternoon, sir. How are you?
Angry and good? गुस्से में है मीनू मेरे से बहुत। आज शाम को निकल जाएगा साइंटिफिक प्रोग्राम में I'll be relaxed यार बहुत लंबा काम चल रहा है।
Yes.
करते रहो।
Cheers. Meenu 1 and Meenu 2 we have.
Both Meenus.
Yes.
Big
Yes.
small Meenu.
Hello, good afternoon. Good
Hi
afternoon.
ma'am, how are you?
sir.
How are you? How are you? Great.
Thank you.
Camera is gone. Sorry. Hi.
Yes, बंद कर देते हैं.
आप लोग शुरू करें
Hello
मैम?
sir,
Hi,
good afternoon.
hi. How are you? How are you?
Hello sir,
Good to see you all.
कैसे हैं?
बहुत बढ़िया जी, बहुत बढ़िया जी। तो एक मिनट मैं आपको बता देता हूँ कोई क्लियर गिव यू सम न्यूज़ मैं आपको बता देता हूँ ग्रीन एनर्जी को बता दे पैनल का बता दे एक मिनट ये क्या है अर्चना अर्चना चेयरपर्सन पे वाली डालना उसको मुझे आपको दिखा के बता दे एक मिनट
Green eye.
हाँ हमारा एक पैनल है एक हमारा यू नो ना जैसे पैनल ऑफ अराउंड 45 मिनट्स 30 minutes and it is on it is on IFS pilot project pioneering fertility solutions you're aware of that ना आपको मालूम है
Yes, sir.
नहीं
इसके अंदर जो मैंने किया है अभी इसके अंदर there are two people Dr. Loveleen and Dr. Bindu will do the moderation
जी
Yes, sir.
ठीक है मॉडरेशन करेंगे जो मेरे को समझ में आया मैंने दिस व्हाट आई हैव डन आई एम जस्ट कीपिंग अभी बनाया मैंने ये इसके बाद डॉक्टर मीनू डॉक्टर रितु डॉक्टर मनीषा डॉक्टर भारती डॉक्टर शालिनी डॉक्टर सरप्रीत डॉक्टर योगेश डॉक्टर आंचल को मैंने एक ऐसे ऑर्डर में डॉक्टर मीनू अग्रवाल आई kept them in the on the stage as sub panelists
This
This
is
what I-
now.
and it is for 35 to 40 minutes it is just before my oration incidentally just right before इस टाइम पूरे हॉल बंद रहेंगे
Hmm.
so we are going on a big scale for this ये छोटा सा नहीं है so this is what I've done so this is with my and Dr. Sonia Malik and me will only be sitting on the chair as expert that's all
Yes, sir.
your show the way you handle it so Dr. Sonia and me will be experts with nothing to do but main thing will be Loveleen and Bindu and these name people have taken on the screen कुछ
Yes.
और हो तो मेरे को please guide कर दीजिएगा because this is what I could think I've done it I may not be always wrong but I've taken the active members whosoever have been active till now I've taken them in this group
Yes, sir. Yes, sir.
reading the names again we can add more names also but Ritu Khanna Manisha Vajpayee in seniority भारती मैडम, शालिनी, हमारी शालिनी दिल्ली वाली, सरबप्रीत, बॉस, योगेश कुमार, आंचल अग्रवाल, मीनू वशिष्ठ, मीनू अग्रवाल। दिस नेम्स आई हैड टिक्ड। आप कोई और नाम डालना चाह रहे हैं तो मीनू
Sir,
वशिष्ठ
Meenu also. Meenu Vashisht.
मीनू विशिष्ट हो गया,
हम
दोनों
नहीं,
मीनू हो गए।
मीनू
अच्छा,
तो
दोनों
होनी है ना।
हो गए। Okay,
मीनू
okay.
मीनू ने तो किया सब कुछ।
Yes.
शी
मीनू
इज
has
वर्क
been a-
वेरी वेरी
मीनू
हार्ड,
has
Very
been my
hard.
pillar यार। मीनू has been
शी इज वर्क वेरी वेरी हार्ड,
हाँ।
पिवट पिलर सब कुछ।
फेविकोल तो ये रही है ना, शी इज
Backbone,
द फेविकोल।
backbone.
एरलडाइट है मेरी मीनू।
Yes.
मैं बिठा दो इसको।
Yes, yes.
पर ये किया मैंने भी, मेरे को बता, गलत हो तो रोक देना मेरे को, अभी फिर फाइनल कर रहा हूँ मैं। आई थॉट आई विल डिस्कस विद यू। इज दिस ओके? एनीवन आई एम मिसिंग हु हैज वर्कड? मीनू वशिष्ठ,
सर आई एम थिंकिंग, मैं सोच रही हूँ।
बता दे बेटा, हो तो नाम दे।
डॉक्टर भारती तो बोल दिया आपने।
दोबारा बोल देता हूँ बेटा। ऋतु खन्ना, मनीषा वाजपेयी, भारती धोरे पाटिल,
डॉक्टर
शालिनी।
निषाद सर, डॉक्टर निषाद चिमोटे ने डिजाइनिंग का पूरा उन्होंने दिया है
तो
कंटेंट।
फिर एक को निकालना पड़ेगा, उनके साथ वाले से निकालना पड़ेगा मेरे को।
सर क्योंकि ना जिन्होंने कंट्रीब्यूट किया है मेजरली उनको तो आपको करना
Dr.
बिल्कुल
चाहिए।
मैम।
Charulata also. Dr. Charulata from the novel.
नहीं मैम, नहीं ऐसा नहीं, कभी ओनली टेक लीडर्स को लेना है ना हमको। वी कैन नॉट टेक द टीम्स।
Okay. Okay, sir. Fine, sir.
देखो मैम, वी हैव टू टेक द लीडर्स। सी, contributors can be many, but we have to pick up the
Yes,
particular
sir.
two leaders who have led, na? Like in seven guidelines which are making, there are more than 180 contributors, but
Yes.
we'll only put 7-8 people, na, who are the leaders. You can acknowledge them. See, you can
Yes.
make them get up, you can get them on the stage, you can ask them for an opinion, but जब हम किसी को बिठा रहे हैं तो फिर we have to get people who are part of the conveners, है ना? तो कन्वीनर में दो दो लोग ही है ना, उसमें से एक को ले सकते हैं ना। वी कैन नॉट टेक टू कन्वीनर्स ऑल, फिर ऊपर स्टेज ही बढ़ जाएगा ना, इट लूज द रेलेवेंस ओनली।
And everybody will not get a chance to speak, so just being there and not speaking is also doesn't make sense.
हाँ, हमें कन्वीनर लेना है बेटा। हमने, अगर आपको नाम निकालना है तो मैं निकाल देता हूँ, बट
नहीं
अगर
नहीं ठीक है सर,
अगर
परफेक्ट
हम कन्वीनर तोड़ेंगे ना, इन केस वी गो बियॉन्ड कन्वीनर्स, फिर क्या रहेगा कि फिर बाकी को और बोले कि मैंने भी काम करा है, फिर तो 80 पीपल विल स्टैंड अप एंड से, अभी तो बोलेंगे दो में से एक को लिया है एंड आई कैन से कि उन्होंने काम करा है।
सर मैं इसलिए कह रही थी क्योंकि डिजाइनिंग में ऑल्दो मनीषा हैज डेफिनेटली लेड इट।
मनीषा को निकाल देते हैं ना। अगर कन्वीनर में कौन है बताओ, उस ग्रुप में कौन कौन है?
नहीं
लिस्ट
सर,
बता
मतलब
दो।
ये आप देख लो, बिकॉज मनीषा ने स्टार्ट तो काम उसने किया था, बट डॉक्यूमेंट मेनली वाइट पेपर का जो दिया है वो डॉक्टर निषाद की कंट्रीब्यूशन रही है।
कौन कौन है? दोनों
और
टीम में है
उनको
क्या?
हम किसी भी प्रोग्राम में अभी तक इन्वॉल्व नहीं कर पाए, मेरे को लगा था
टीम में
They
कौन
are
कौन है? टीम में
they
कौन
are
कौन है?
both in the same team.
हाँ।
Manisha
देखो
and
मैं देख के
Nisha.
बताता हूँ, अभी देख के बताता हूँ मैं। एक्चुअली आई वांट टू आस्क यू। देखो, फर्स्ट ऑफ ऑल मैंने बार बार तो काम, मैं भी पहली बार ही कर रहा हूँ इस तरह का इवेंट, मेरे से भी गलती हो सकती है। सबसे जानना चाह रहा हूँ मैं विथ यू, आई वांट टू ओनली गो टू कन्वीनर्स। निशाद नहीं है, युवराज जडेजा है इसके अंदर।
हाँ, निषाद कन्वीनर नहीं है, बट मैं आपको यही बताना चाह रही हूँ सर कि उन्होंने जो वाइट पेपर का कंटेंट है विच इज द
तो
मेजर
बात समझ नहीं पा रहे मीनू, बात समझ नहीं पा रही है। वी हैव टू पिक अप टीम लीडर। सी, अगर हम इसको तोड़ेंगे ना, इसको तोड़ेंगे, so then we will be in problem because we cannot break, we will pick up one from the team.
Yes, sir.
We cannot go to the members, understand? अगर एक member पे जाएंगे तो फिर we'll be in, that's not the way things happen ना in a conference. We will pick up a team leader.
ठीक है, जैसे आपको ठीक लगे सर वैसे।
So I felt Manisha has worked more than Yuvraj, so I put, see what you can do is, अगर आपको लगता है कि इसने अच्छा काम किया है, so then we'll have to get him on the dash. You get him on the dash and we'll publicly acknowledge for the white paper. But we'll pick up one from the convener team. उसके नीचे जाने के बाद फिर पूरा पेंडोरा बॉक्स खुल जाएगा।
नहीं सर, एज पर प्रोटोकॉल जैसे अभी जा रहे हैं द कन्वीनर्स, दैट्स फाइन सर.
ठीक है मैम। तो
नहीं सर हैज अ
So-
पॉइंट, वो there'll be too many bad feelings otherwise, फिर वो
हाँ।
मुश्किल हो जाएगा फिर, है ना? तो ठीक है, we can always get him to, some people can be acknowledged on the
Acknowledge
stage.
Some
करेंगे
people
उसको।
can be acknowledged, ma'am, because some have
मैडम,
been more active than the others, so maybe they
हाँ.
can be
call for,
acknowledged.
madam, I will acknowledge him in an appreciation award. We will give him an award. You can call him on the stage when you are releasing the white paper. Stage पे बुलाइए ना, को stage पे बुलाइए,
Yes.
उसे रिबन कटवा लीजिए। Absolutely okay. एक
नॉट
कॉन्वेंस के अंदर
ओनली
हम
हिम
थोड़ी
सर,
सी
और भी नाम
टीम
कुछ
लीडर।
होंगे इसमें, मतलब वो हम थोड़ा एक नोट बना के मैं आई कैन शेयर कि जिन्होंने रिलेटिवली ज्यादा
जी
एक्टिव
मैम
रहे
जी,
जो लोग।
विद यू मैडम, विद यू, बट यार समझिए कि जो हम कर रहे हैं, वी आर पिकिंग अप टीम लीडर्स। सी वी
अंडरस्टूड।
आर पिकिंग अप द टीम लीडर्स, वी इन केस वी ब्रेक दिस पैटर्न, तो फिर वो चीज हाथ से निकल जाती है किसी भी मीटिंग के अंदर।
That's absolutely fine, sir. Panel discussion, team leaders, and then when we are releasing the white paper, maybe we can call the others on stage.
प्री ओरेशन आप बुलाइए ना,
Yes.
प्री ओरेशन के अंदर नॉर्मली थोड़े हॉल में लोग रहते ही हैं, बुलाइए बिल्कुल, सीट पे बुलाइए, आप उनसे रिबन कटवाइए। मीनो श्योर श्योर, मैंने पहले भी बोला है, you have been the Fevicol and Erudite of the whole team. So
नहीं
we don't
सर,
take your call
जो
nowadays,
मैंने तो अपनी
but
ड्यूटी की है, बट ये है कि जो बाकियों ने कंट्रीब्यूट किया है सर, उनको भी तो हमें, मतलब वी डोंट हैव टू लीव देम आउट ना, क्योंकि
you
सम
can't get them
पीपल
on
आउट ऑफ
stage,
द
Mino.
70, आउट ऑफ द 70 मे बी 10 और 15 हैव कंट्रीब्यूटेड,
Mino,
सो
you can't
10
get them on
15 को
stage ना,
तो शाबाशी
बाबा,
देनी जरूरी
you
है।
can't get them on a panel discussion ना, वो कैसे करेगी, लॉजिक लगाना तो। You can call them on the stage and you can give them something, but you can't get them on the, then you
आई विल
can't
गिव यू
have
द नेम्स, आपकी बात सही है, मैं आपको बस नाम दे दूंगी।
नाम देके आप उनको बुला लो, कर लो उसको, ठीक है, डन। सो आई एम डन विद इट, अभी आगे बढ़ो, चलो शुरू करते हैं काम। वेयर आर वी?
सो सर बेसिकली तो डॉक्टर लवलीन और डॉक्टर बिंदु ने आज आपको असेसमेंट देना है ऑफ व्हाट हैज बीन द प्री एंड द पोस्ट असेसमेंट दैट वी डिड इन अगस्त।
यस,
अगस्त वाला समरी भी आपके साथ शेयर किया था। मैम बिंदु मैम,
Yes.
आपको प्रोजेक्ट
Yes.
करना पड़ेगा।
Okay. Dr. Loveleen, you want to say something? Then I'll just share
नहीं,
these.
we'll talk as we go along, I think.
Yeah. So, sir, we were supposed to assess the centers majorly on 5 different criteria, whether it is water consumption, electricity consumption, carbon footprint calculation, and the green IVF criteria.
जी मैम,
So, the thing is, the problem with carbon footprint calculation was that Dr. Loveleen has already spoken to an architect, and she said it's difficult. Then online carbon calculator also. So there are too many factors that need to be taken into consideration, which immediately we cannot implement. Maybe we need to understand how to go about it. And as far as electricity and water bills are concerned, for this period, for these 2-3 months of period, it will be difficult because we are talking of summer and now. So as it is, there will be a difference. And like Dr. Meenu Agrawal's center is already under the process. She is, I think, making a new center, which now she is incorporating many new criteria. So she will have new things now henceforth. And yet we have asked for electricity and water consumption bills. And the other main factor is that
Diesel also.
few of the centers are a part of a major, multi speciality hospital. So for them to get separate electricity and water consumption bills is also difficult. So these are the practical problems. So for now, the assessment that we have been able to do is the green IVF assessment on the various criteria that we had prepared. Yeah, Dr. Loveleen, you can add to this and then we'll share.
Basically, doctor,
पूछो बेटा, एक मैडम एक चीज मैं पूछना चाह रहा हूँ। we have many people here, we have Komal, Vishwadeep, Ninam, Suraj, Ravali, Kolala. They are from where? We have not met these boys, we have not met them.
Actually, the people have not been able to join. Dr. Ruchika has sent a, spokesperson, or rather one of the team members. So similarly, Dr. Lakshmi. So they have not been able to join so far. They've caught up with their work. So I
Okay,
think they're part of their team. So they're representing.
but I hope they are aware of what we are talking about.
I hope so. They take the message. I had told everybody that they should be joining on time.
Hi Vishwadeep, how are you? Just no, she's Lakshmi only.
Yeah, I'm
Yeah,
here,
Dr.
but
Lakshmi is
I
here, na?
joined from a different account.
Lakshmi is here, huh? That's what I'm saying. So thank you, Lakshmi, for joining. So now, as we are now going to the final leg, Minu Vashish, MV. Now there were 5 centers
And
fine.
sir, Dr. Sharanya has not, she says she isn't coming for the second round of, she's
कोई बात
walking.
नहीं बेटा. So there are 4 centers, na? So there are 4 centers we are dealing with now. Now, which all are these 4 centers now? I just, just want to go
Dr.
into the
Meenu
stream.
Agarwal, the
Yes,
ma'am's
I
from
know.
Pune, Dr. Saraprit Artemis,
Mhm.
Dr. Lakshmi is ART Hyderabad, and we have Dr. Ruchika Goel from Bareilly. 4.
4 सेंटर हो गए ना हमारे पास. Done. Okay, now please carry on, ma'am. Please carry on. Lavleen, ma'am, please carry on.
हाँ जी, हाँ, I was just mentioning that 3 centers have shown a lot of improvement, especially Dr. Meenu, since she was probably making a new center, a lot of changes, so it was most, I think, convenient and, practical for her to do it. So Dr. Sarappreet's center was already very eco-friendly and green, so we don't see much change there. And the other 2 centers have also definitely improved. But still we need some more documentation from them in the form of the, like Dr. Bindu mentioned, electricity and water bills. Only Dr. Lakshmi has mentioned so far. Others may or may not be able to. And the paper use and things like that also, some people have already come up with. So, Dr. Meenu Agarwal, Dr. Bindu, are you talking about this? This is the older one, I think. The one where you had marked with green the changes and the yellow ones.
Yes, at the moment, Dr. Loveleen, at the moment, whatever changes I have done, I am done in the same center,
Okay.
which is my center, existing center. So I'm planning to make I mean, it's already there in the bigger center, but that is going to take some time.
Okay, so
it's,
that is even more appreciable if you've done all the changes in this center
right.
itself.
So in that
And we
you
would
have the solar
like you
panels
to
and all.
walk us through those changes that you have done. I guess when we do the video.
Yes, that is in the existing center. So
Okay,
my
wonderful.
building is going for redevelopment. I don't know where of this thing it is on this part of the country. So when a building goes for redevelopment, a builder takes over the building and then he gives you an extra space and however you want the space to be built. So something like that, but that is going to take little time, maybe a year or so to get completed. Mhm.
Okay. Dr. Bindu, will you take over?
Ma'am, we can't hear you. You're muted.
Okay. So just a quick run through the assessment that we had done in August. Basically, compliant, partially compliant, non-compliant, 0, 1, and 2 marking we had done. So this is the pre-assessment marking for all the 5 centers, Dr. Meenu, Dr. Sarappreet, Dr. Lakshmi, Dr. Ruchika, and Dr. Sharanya. So these were the marking we had done. And now again, after 3 months, it's not even a full 3 months. Just a moment. Okay, this one. I hope you all can see this as well.
We can.
Yeah. Okay. So the same criteria again, but here, wherever they have shown a shift from non-compliant or partially compliant to compliant. So Dr. Meenu Agrawal, as already mentioned by Dr. Loveleen, quite a few changes they have been able to incorporate. So for example, the natural harnessing of natural light and all, LED lights, reusable cap masks and all. So from partially and non-compliant, they have moved over. So obviously, and the ones that were non-compliant, some of them have been able to partially comply with the criteria. So accordingly, obviously the gradings have increased for all the centers. All the 4 centers have really done well. Dr. Ruchika Goel also from non-compliant to partially compliant. Similarly, Dr. Sarappreet Singh, here we really need to mention that his center had already been complying with many of the norms and they have tried to better themselves in all the aspects. So solar, it is difficult to install, so that remains non-compliant. Rainwater harvesting, wastewater harvesting, and these recycled paper, this actually does not count here because they are totally paper free. So actually we need to add more points for them because they are totally paper free. And so yes, Dr. Sarappreet Singh Center and then Dr. Lakshmi's center also, They have mentioned also the decrease in the electricity and water consumption that they have been able to implement. So this is how the assessment has been done for all the 5 centers. And as mentioned already, Dr. Sharanya's center, she has withdrawn for now for personal reasons. She said she needs time, but then she hasn't let us know how much more time exactly. So if
She
you can get,
mentioned that if there is a later round now,
yes,
so that's what she mentioned. So which doesn't look like any time now.
yeah. So, so far as electricity and water is concerned, we have asked for electricity bills. Dr. Lakshmi has already shared. So, at least in the existing, in these given 3 months before the Fertivision conference, whatever we can really try to assess from those electricity bills, maybe we'll try to do that.
मैडम इसमें कुछ भी ना सब्जेक्टिव है, सब कुछ ऑब्जेक्टिव कुछ भी नहीं है, बहुत कम है ऑब्जेक्टिव। देखो अगर हमको ट्रूथफुली
Objective,
करना है, ऑब्जेक्टिव दिखाना पड़ेगा ना, वेयर आर वी ऑब्जेक्टिवली?
Yes.
वी आर ओनली गोइंग बाय द फीलिंग्स हमने किया, बट
नहीं
डेटा में
सर, अभी
एनीबॉडी कैन
ऑनलाइन अभी वर्चुअल असेसमेंट करके एक्चुअल विल बी एबल टू सी what changes have really been incorporated.
हाँ, because
that is what we have gathered here now for, that we'll take a virtual tour just as we had done initially. पहले भी जो किया था अगस्त में, we had taken a virtual tour and we had noted down and we had
और चीज कर सकते हैं मैम, जैसे व्हाट सर प्रॉब्ली मीन्स इज कि जो एक एक पॉइंट है ना प्री एंड पोस्ट असेसमेंट का, उनका मार्किंग का भी कॉलम बनाओ। प्री असेसमेंट इतने जैसे 1 मार्क था, पोस्ट असेसमेंट इस पॉइंट का 2 मार्क है, तो वो ऑब्जेक्टिव हो जाता है।
तो वो कैसे अभी कल रात तक ही आया है, इसलिए यहाँ पर ग्रीन हाईलाइट कर दिया है। अदरवाइज वी वर गोइंग टू मेक अ टैबुलर फॉर्म हर एक सेंटर का प्री एंड पोस्ट, बट सिंस वी हैड नॉट इनफ टाइम वी जस्ट हाईलाइटेड टू से दैट ओके दीज आर द चेंजेस। तो कंपेरेटिव भी कर देंगे फॉर ईच सेंटर, प्री एंड पोस्ट विल डू दैट। एंड अभी लाइक आई सेड कि टाइम है नेक्स्ट 1 महीना और till Fertivision, so we'll try to incorporate. Or Dr. Loveleen and I had also written down the points when we had done the virtual assessment of the centers last time in August. Now we'll see again and we'll tally it with these points. They have said that they have brought about changes, but we'll actually see them. Yeah. Dr. Loveleen, if you need to add anything, please.
nothing much else, because
आपको अगर इंस्पेक्शन लेनी है वर्चुअल टूर, तो आई हैड टोल्ड एवरीबॉडी कि दे शुड बी रेडी फॉर दैट।
I think we need to do that. Definitely we need to do that.
Yes.
So who can be the first one to start? Will you volunteer, please? Any one of the centers?
We can do, Dr. Meenu. We are ready.
आप करो please start करो. Which center is that, Dr. Lakshmi?
Dr. Lakshmi.
Yeah, okay. So that is.
Yeah, Dr. Ravli will take you through in the OP, and Ninapta will show you in the OT. Okay, she started already. Ravli, you are not audible. Unmute.
Good afternoon, everyone. So,
yeah, just good afternoon, Dr. Shweta. Welcome.
Yeah, hello. Sorry, I was late, so I didn't want to interrupt.
Good afternoon, ma'am.
Good afternoon.
Hi. Sorry, yeah, please continue, karo.
good afternoon, ma'am. So, showing the changes compared to last time, ma'am. So, this is our OPD room with ample amount of sunlight. And we have VOC paints and all the lights are LED with smart switches, ma'am. And we are using reusable water bottles.
Can you change the angle?
Translation.
The angle of the camera is not correct. Yes, now it's all right. No. It's upside down for us now.
Is it okay, ma'am?
Yes, now it's okay. Yes, correct.
Okay, ma'am. So we are using reusable water bottles also, ma'am, and we have placed like indoor plants also. And for all the case histories and all, we are using online things only, and prescriptions we are maximum trying to do it online, ma'am. And all the reports we have cut down to digital reports, and we are giving the patients also, including discharge summaries of the embryology lab, and even all the other blood reports also we are giving digitally, ma'am. So we have cut down on all that paper thing, ma'am. Ma'am, we have started using these reusable files, and whatever files we are using, all the papers after the cycles are closed, we are keeping inside, and we are changing the labels and using the same files for other patients, ma'am. So we have made them reusable. And regarding disposable glasses that were mentioned in the last meeting, ma'am, we have replaced with recycled based glass bottles also, ma'am. But few patients are not so willing to use these glass bottles, so we have replaced them with paper ones, ma'am. So our OT and the recovery rooms are in another floor. I show you. We have replaced the disposable caps and masks with reusable linen ones, ma'am. And all the patients and all the OT linen we are using reusable, ma'am. And in as discussed in the last meeting, we have replaced them with the teal ones, ma'am. And we have smart switches for the OT also, ma'am.
Sensory, this thing, stimulus based, right?
Yes, ma'am. And embryology lab, Nenepta will take over and she'll show inside.
So smart switches, you mean that when you enter the room, the switches come
The
on, and
movement
when
sensor.
somebody
Yeah.
with the movement they come on, and when the movement is not there, they go off. Is it so?
Ma'am. No, ma'am,
Yes,
these
ma'am.
sliding ones are like smart sensors, ma'am.
Okay, acha, you are talking about the door opening.
Only.
Sliding doors. Yes, yes. And yes, ma'am. Inside the lab, the embryologist will take over and she'll show us, ma'am.
What about these switches, the LED, the ones which are used for lights and fans and other things?
We have LED lights, but they are like manual switches, ma'am.
Okay. And the water, in the scrub
Wash
stations,
area.
the
Wash
washing
area.
areas, scrub stations, have you
Yes, ma'am.
added some
That is
sensors
knob.
or something?
They are like the knob operated ones.
Okay, they're foot operated.
Yes.
I can see the foot
Foot.
pedal. That's very
Yes,
nice.
ma'am.
That is actually
Yes,
the
ma'am.
best, having the foot
Yes.
pedal.
Yes,
It is
ma'am. Yes,
foot
ma'am.
pedal and it all stops on its own. We don't have to stop it. Immediately after we come out, it stops.
Yeah.
I mean, that is how I think they have written there is a 20-25% decrease in energy consumption as well as water consumption.
So how many of these changes, Dr. Lakshmi, you have made recently ever since
I
you
think
joined
this
the...
was already there, ma'am, last time.
These
I
were
don't
all
think they've
there.
changed
Most
anything
of
yet.
these were already there,
It's
Hana?
already
We-
there.
These were already there.
We reduce the energy consumption. Definitely, the electricity bills have shown that 20% decrease in the cost.
And is the weather kind of the same as it was in the summer, or as such
Yeah, it
the
is almost the same.
air
It's
conditioning
almost the
use has
same.
not much reduced? Not in Hyderabad. Huh? North India, there's a
No.
lot of difference now.
Yeah,
But
yeah.
what about
In
Hyderabad?
Hyderabad, it's still very hot.
Okay.
We still use, but people have become more sensitive in switching off whenever they are not using.
Yes,
All those kind of
that must be
things.
the reason. Yes, yes, yes.
Yeah.
So
So you can clearly see that there is 20% reduction in the electricity bill. And also we made that linen caps and masks. That is one thing
I
which
think
we
you had disposable ones. Now you have moved to
Yeah.
reusable ones.
Reusable.
Plastic use also.
Plastic use also.
Plastic use also.
Yeah.
And what I think we are yet to see the embryology lab. The LN2
Yeah.
storage also has been shifted, I guess, to conserve the consumption of liquid nitrogen.
Yeah. That we started using. Our embryologists will mention what they have done regarding that. Ninapta, please continue.
Good afternoon, everyone. I'm going to show you the embryology lab now. Okay, so this is the embryology lab. So now we are having waste coded into different containers according to the norms. So every station has a black, a yellow, and a red one. So the waste is discarded accordingly. Also, we have started using disposable masks and caps, as you can see, which has greatly
Reusable,
reduced.
not disposable.
You have
Reusable.
used
Not
cloth ones
disposable,
now.
yes.
Reusable.
Yeah, we use cloth ones now. So each get some and we reuse them every day. And LN2 actually is now here. Sorry, some filters. Okay, LN2 is here. So what we are now doing is we are only removing LN2 when we need it. So it's stored in these big tanks now. So we are only removing it when we need. So we are greatly reducing the consumption and the evaporation of that. We are not keeping it in store outside so it can evaporate. And we are yet to get the trolley as mentioned last time. Because we have the room adjacent to the andrology room, it is greatly it is not possible to get the trolley in and out at the same time because of the people working in the andrology room. So we are trying to
So
get ahead of
has your LN2 consumption gone down? Have you documented that after doing this? Has the
we have
wastage reduced?
Yes, so according to the number of times we are ordering than before, we have greatly reduced the number of times we are ordering it. That I will put it in next
I think,
time.
ma'am, this should also be documented in each center.
Yes,
Yes,
ma'am.
we can do
I
that.
will do it. I will do it right now. And
We need
we have also last time one
measurable
more
quantity
concern.
for most of the things. Yeah.
Sorry.
Yeah, so for everyone, not just for this center, for all the centers, as far as possible, in wherever we can put a measure to anything, like paper use, if you have reduced, not completely, I mean, stopped using, but you're using to a lesser extent now, put a measure to it. Similarly, water consumption, electric consumption, wherever we can put a measure, LN2, everything, media. So put a measure,
Diesel.
the thing, quantify,
For
and quantification is necessary.
Yes, ma'am. And also regarding last time, we discussed about paper consumption and plastic consumption again. So we're using fewer dishes according to the cases. We are not using dishes carelessly now. And also media allocation, everything is done according to the cases. So it is much more
Can you
precise.
quantify that also? Because one of the things which is missing,
Quantification
you
of
are
the
still
media.
non-compliant. There are still few things which include SOPs for quantification of media. So if
Yes,
you
ma'am.
can
So
quantify an average per patient or per month, something like that, है ना? If you could
yes,
share
ma'am.
that
We have
also.
actually
And
started doing that.
hmm.
We have
I think all variables which can be quantified have to be given in numbers, ma'am. Otherwise, as sir said, we're making it subjective and no figure
So
to it.
now, what we can do is after the virtual assessment now, we'll make a list of the things that can be quantified, and right from August to, I mean, we'll put up a deadline before Fertivision, during which you will need to submit, I mean, quantify everything and submit so that we have a better report.
Sure, ma'am. Sure. We'll do that. And we have also greatly reduced the use of paper. So we are giving all the files in online now, all the case notes and everything. So we are not using any registers or any other papers are being exchanged. So we have greatly reduced that as well, and we have removed all the plastic from the lab. and we have got huge storage boxes to keep things so that cardboard or any other such things are not hindering with the hygiene of the lab or causing more waste. Thank you.
For all the centers, again, it is possible that even if you say that you have started using reusable caps and masks, there may be certain people who don't like to use this and you still use disposable. So there again, there can be a quantification that we have been able to reduce 80% or 70% of whatever. So for all the centers, it's the same that it is not possible to eradicate the use completely, probably, but wherever you have come down or reduced, quantify it and let us know. We'll give a list of all the things that need to be quantified.
Sure, ma'am. Sure.
I have one doubt. Madam, in terms of consent forms, how are the centers doing? What is expected? Because, without
that you can't do anything because you can't change laws.
To have hard copies.
So we should be doing that, isn't it?
That
It
you
can't
have
be
to.
completely paperless.
Because see, that is as per the law, the compliance, the government is not going to change rules for us, no?
So,
That we
yeah.
can change.
Yeah, that's the only place where we are using paper. Otherwise, we have almost completely moved to paperless.
I mean, to be on the safer side, you need to do that actually.
Yeah.
Okay.
Okay, thank you.
Thank you. Now, who is going to be the
Lakshmi,
second?
surprisingly, you haven't made a green team. I mean, that's a simple thing to do. You just have to have some people dedicatedly part of the green team. So that's an easy thing to do. So maybe we can just move to the compliant thing if you.
Yeah, we have the green team. Whoever logged in now, they are the people who are monitoring all this, whether it is happening or not. So we'll mention that.
Yes. So that should
Shall
also
I
be
go
the
ahead?
compliant.
Shall I go ahead?
If you have formed a green team as well, just what all you have done, if you have had some lectures or some awareness, make a note of that also. So as part of awareness green initiative, what all things you have done, whether for the patients or for your staff and the green team, whatever they have done, please make a note of all those things. Again,
we
it's
did
for all
one meeting.
It is for all the
To
centers.
create awareness, and also we did the bio-waste disposable for the staff.
Okay.
I think that takes us a long way.
Yeah.
We'll mention that as well.
Yeah.
Thank you so much.
Thank you. So just make a report of all the things that you have done.
Yeah.
So
Yeah,
rather
yeah,
than
sure.
point wise where yes, no, you have to click, just make a summary of all the changes that you have brought about. So it will be more, you will be more elaborative with that.
Yeah, sure.
Right.
We'll do
Thank
that. Yeah. Thank you.
I think Dr. Meenu ma'am
Yeah.
wants to probably do the second because she might be running short of time.
Okay.
Meenu ma'am?
Yes, sure. So I will just reverse my camera on my phone. All right. So, okay. So I will go by the previous speaker. So how she showed. So these are the large big windows. They were already there, but I've just slightly changed my furniture so the lights now come in without any obstruction. So that is one thing. Then of course the paint is again that
VOC free.
yes, so VOC free paint here. And then I've changed the glass. Now they used to give me everyday disposable water bottle. So now this is a glass, glass ka glass, which they give me in water in. And from the filter water, it directly comes in. There is some green plants also in my OPD, just so that it gives a better feel to sit in, as well as it maybe gives us some oxygen during the daytime. So this is what was the OPD. And then of course, I think all my rooms everywhere, they have light. Actually, I have got 3 or 4 consulting rooms. Everywhere we have those big windows facing out, but now we don't put the curtains on, keep them up, and then you can see a lot of trees all around. And then instead of okay. और क्या बताना था? So this is all VOC. This is my lab. I'm showing it from outside. So this is a glass here. So the it's a see-through lab. Actually, the entire lab is see-through from outside. So patient's husband can stand outside and watch the ICSI being done or the oocytes being denuded. So all that is a possibility. And all these are color coded wherever we are collecting the disposables. They're all color coded.
It is color coded.
Yes. So. So again, as I said, and then that way, even Pune weather is like that if we keep the window open, we don't even need to use the AC. So AC is most of the time switched off. So it is good for the green initiative. So that is another thing which now I have started doing, keeping all the, some windows open, good breeze coming. So no need to use the AC.
So, since your center is an independent center, you should be able to share the electricity bill with us, I hope. Hello.
I am independent at the corporate hospital. I could
Okay.
also show that the whole thing, but I thought it is better to include my center because I have more control over here to change things as compared to in the corporate center. So again, as we discussed last time, we are now trying and doing putting all the cases together, freezing at the same time as far as possible. And this is the Ecolog net here. क्या है? CO2 LN2 measurement. So this just measures your CO2 and LN2. And today my embryologist has not come. Otherwise, he would have actually told you better about the changes that he has made in the lab. But I will give it to my junior embryologist. तो वो आपको थोड़ा सा जो changes है वो बता देंगे. 1 minute.
We do still see some plastics, but maybe you have to by and by remove them. है ना? Most of it is gone. I remember last time there was plenty. So
अभी कम
now
हो गया
just
है.
हाँ अभी बहुत कम हो गया है, but maybe you can do away with this, and at least I think all of us, we should not be buying more plastic equipments or things, you know.
Yes, yes. So I'll
Whenever.
give it to Chandni. She is a junior embryologist. तो आपको और कुछ जो भी changes है थोड़े जो उन्होंने किए वो बता देगी. The senior embryologist is on leave today. Chandni आप बता.
Yes. Hello, ma'am. Good afternoon.
क्रायो स्टोरेज का बता दो एक बार.
I
थोड़ा
think
स्कैटर्ड था सारी जगह पे.
the plastic usage that we cannot prevent, the paper and plastic, is the consent forms, paper consent forms, which we need to keep, and plastic to keep in the dustbin. Also, we get plastics only,
Plastic
the colored
only.
ones. So we cannot do away with that. That will remain. And of course, the packaging that comes in the dishes and all, that plastic we have to. We cannot change that. So the bare minimum things that we cannot avoid. Apart from that, yes.
And yeah, so I'm the only one. And everybody is wearing. You can see here the cap, mask also we changed last time. I think somebody did point out कि disposable अभी सबका ये cap मैंने ये नए set से लिए हैं. They have the matching cap and mask, so they are also happy. So they all have these matching caps and masks. So अभी ये कपड़े के हैं, wash होकर के आ जाते हैं, and then they wear it again. So that disposable का is become much less.
मैम क्रायो स्टोरेज एरिया का नहीं दिखाया मैम. वो पिछली बार आपके बहुत सारे सिलेंडर्स इधर उधर पड़े हुए थे, वो थोड़ा दिखा दी मैम.
क्रायो स्टोरेज का हाँ 1 मिनट.
Yes, ma'am.
ये बस इधर एक तरफ. अच्छा क्योंकि
ये स्टोरेज है.
आप सेग्रीगेट नहीं कर पाए ना. आपने कहा था हम कुछ कोशिश करेंगे, बट आई थिंक वो आपका ओपन सिस्टम सा ही है अभी भी, है ना.
Yes, ma'am. और ये वाला अलग है, ये अपना इन्फेक्शन वाला है, HbAcG वाला।
नहीं, नॉर्मली क्रायो स्टोरेज थोड़ा एक अलग से रहना चाहिए, बट आई थिंक आपके पास वो भी बैंडविड्थ नहीं होगा आपके सेंटर में।
ये ये हाँ मैम।
ठीक।
ठीक है, ये फिल्टर फिल्टर।
Yes. Anything else I need to show?
बिंदु मैम, लवलीन मैम, सर, श्वेता मैम, आप इसमें
So
कुछ
see all this,
whatever
even the
changes
injections are kept so that they are seen from outside what is there inside or what is not there. So I don't have to open the refrigerator every time to see कि वो इंजेक्शन अंदर है या नहीं है, तो वो मुझे बाहर से ही दिख जाता है. So again it is like less wastage of energy opening the fridge and closing the fridge. So this is that cell frost which has a glass door and you can see everything inside directly.
So is this a new equipment that you have purchased, or it's the previous
Cell frost,
also you had it?
yeah. I didn't show it last time, so it is not a
Okay.
new one, but I bought it very recently.
Okay. And the star rating, otherwise, how?
It's all 5-star. Cell frost, and even all the ACs are 5-star. All Daikin 5-star ACs. So that is
Very nice.
so you can see here, so they are all Daikin 5-star rating. I don't know if you can read it.
Daikin we can read.
Yeah, Daikin, all Daikins are 5-star. So I mean, my Daikins are 5-star.
Not all will be, yes. And paper alternatives also, you started using some paper alternatives, it seems.
Better than before. It is not completely paperless, but a lot of things we are now giving as, just a digital thing. And taking even the history and told them not to put it on the paper.
Yeah, I
and
can
just
see this
and just
bamboo
share.
tissue paper. This box is bamboo tissue paper, I think.
This is bamboo, yeah. You can see I
Bamboo tissue.
changed the tissues also to bamboo tissues.
Unbleached and bamboo tissue.
Yes.
Nice.
So no trees were cut in the making of these tissues. You can see here.
And you've written paper usage 500. We didn't understand really what was that 500.
I'm sorry, madam.
आपने quantify किया था कुछ 500. So what was that regarding paper usage, and has it come down?
नहीं मैंने कुछ वो 500 तो क्वांटिफाई नहीं किया था. नो,
वो 500 कुछ लिखा हुआ है आपके फॉर्म में ना, हमें समझ नहीं आया था, तो हमने इसीलिए उसको
अच्छा मैं चेक कर लेती हूँ. मे बी इट्स बाय मिस्टेक दैट दे हैव पुट, बट नो, आई हैव नॉट, I have not put that.
What efforts, like you have said, you are now compliant about the environment friendly product from vendors?
Yeah, so even here we say water filter here, and the water goes, just very regular thing जैसे हमारे पुराने टाइम में रहता था, तो वो glasses में भर के दे देते हैं. Everyone takes in that. Patients sometimes want like more this thing, so we get glass bottles for them.
And the one thing for which is I wanted to kind of discuss for all centers, ESG credentials, checking with the vendors and all, I don't think anybody has been able to do. So I think almost everybody has left that form, that column blank, not commenting on it.
We can still give them some
What
time.
are ESG credentials?
मैम, आपका जो प्रोक्योरमेंट आप जहाँ से कर रहे हो कि वो कितने ESG पैरामीटर्स फॉलो कर रहे हैं, वो कितने कंप्लायंट हैं उसके साथ, वो डेटा अगर आप थोड़े दिन के बाद भी हमें दे दोगे तो एटलीस्ट हमारी
उनसे लेना पड़ेगा अपने को,
बनेगी
है
ना
ना?
मैम, वो ज्यादा ऑब्जेक्टिव हो
We
जाएगी.
have to take it from the vendors. Sorry.
Yeah, you'll have to take that from the vendors, and when you choose what you are buying and from whom you are buying, then you can opt for the more eco-friendly one, na?
Yes, understood.
So
All other documentation, is it on paper or all online? All documentation regarding
It
media
is
wastage.
partially. Documentation is on, it is digital, but sometimes patients want a printout of their blastocysts that we have transferred. So we actually give them a printout.
So you have recently started clubbing your embryo transfers and embryo freezing. It's apparent, है ना?
Actually पहले भी
And
क्लब
you
ही
are
करते थे, हाँ, पर अभी ज्यादा ये
अभी
green thing has come into the mind. पहले भी क्लब ही करते थे because it was more convenient for everyone.
And you are trying to procure your stuff from local vendors also, it seems, है ना?
Yes, we can say that.
And have you made any change in your cleaning products to, I mean, are they more eco-friendly now, whatever cleaning products you're using?
To be very honest, I have been using the same cleaning products.
That is where you have shown the change from partial to compliant, that now you are using more eco-friendly cleaning products and also packaging of injections to the patients. And
I think what if we can just put on the group which are the clinic agents which are more eco-friendly, we can change over to those.
I think move
So
safe.
maybe I am not aware of. I am not aware which are the ones which are more eco-friendly. You know,
by and large, everyone uses USAFE.
USAFE we are using.
And as far as I know, that is the company has a good ESG footprint.
So yeah, so this we are using this EcoSafe only.
EcoSafe. Just for my knowledge, what company is this EcoSafe?
Oculus.
Oculus. So we are not sure about the ESG report of this company. Maybe you can check. Huh?
Yeah, I will check it. This is what we
then some SOPs, because we are just looking at all those things that which you had marked as non-compliant previously and now as compliant. So SOPs for media order and consumption.
Okay.
First in, first out, that kind of thing.
That we are doing. First in, first out, we are doing, yes. That we are following.
And the once again the green team, and if you can kind of note down and let us know what activities the green team is doing. So just to objectify once again.
Okay, all right, okay. So I will put 2 people on the job, 2 or 3, and they can follow. You know, can we make a small group for them so that they know what to look for, what to add, and what to subtract?
So what we can do is, as we already mentioned earlier, that all the changes, you have all the criteria with you, the list of criteria you have. So now just from earlier to now, whatever changes you have made, so rather than this point-wise yes or no or tick mark, you can actually write down what are the changes. Make a summary of all the things that you have changed now in your practice.
Right.
For these last 3 months, so that you whatever minor to minor change you have incorporated, just write it down so that it will be easier for us also.
Surely.
And for quantification, we'll give you a list.
So electricity bill, water bill, all that, of course, I can take out. And again, we discussed about the foot pump. I had this long handle, which is also the same thing, you know. You can close and you can, I don't know if you can see that. It is long handle. So even when you're washing your hand, you can, with your elbow, you can close and open it.
That's right. Foot pump is still little more convenient.
Correct.
So maybe in the future, whenever you are making changes, you can opt for the
No,
foot
I'm
pump.
making a new center. So of course, lots of things I can incorporate there.
Even the ones which come with a sensor, they keep flowing. If you are standing in front and washing, they keep on flowing. So that way the foot pump is the easiest. It flows only when your foot is on the pump. As
The
soon as you
sensor is set for generally set for 1 minute. And you sometimes wash for 40 seconds and 20 seconds
Yes.
water is just
Yeah.
flowing.
So maybe in the future you can make that change.
Correct.
Right. Anything else, Dr. Bindu?
Can we move on to the next one, ma'am, if Dr. Meenu ma'am is done?
I think we can.
I think we can move on. Yeah.
So, Dr. Ruchika, would you like to, or is it Dr.
Yes, yes,
Sarita?
that would be fine. That would be fine. Good afternoon, sir. Good afternoon, everyone.
Thank
Good
you,
afternoon.
everyone. Thank you very much.
Thank you, ma'am. Thank you so
Thank
much.
you. Thank you.
Thank you. Thank you, Dr. Meenu.
Thank you. Thank you.
Hello.
We can hear you, Dr. Ruchika. Please go
Yeah.
on.
Yeah. So, where should we start from?
You can just give us a walkthrough right from the OPD area. I mean, whatever the changes that you did from the last to this time. Just
Okay.
a quick recap of that as you walk through.
Our OPD area is different than our lab area because the OPD area is situated in our
General OPD
obs and
area.
gynae, general OPD area, and the IVF lab is completely separate from that area. So IVF lab, we have the ward from the entry. I'll just switch the camera.
I think last time you had walked us through from wherever you had your little andrology room. I think I remember that. From there to the OT, right?
Just a minute. I'll just have to switch my camera. Can you switch your?
आपका एंड्रोलॉजी रूम दूर था, हमने ये बात की थी ना कि आपका क्रायो कैन मूव होता था वहां से ओटी तक.
तुम अपने से करो. कैमरा क्यों नहीं रोक रहा है? ओके, हो रहा है क्या तुम्हारे से? Is some issue. कैमरा रोटेट नहीं हो रहा है.
किसी और का मोबाइल यूज करना है आपको या क्या करोगे फिर?
हो गया शायद. हाँ, नाउ या लाइट ऑन कर दो इधर एक. This is the entrance of our IVF lab, and here is the non-sterile area. We have the patient waiting area. We have two patient waiting areas. So these are the patient waiting areas. And then as we move forward, then we have our 12-bedded ward first, where we are following all our biomedical waste rules, regulations, because it is a NABH and NMC accredited hospital. So we have to maintain all the records and go by all the protocols of NABH and NMC. So this is the ward which is well lit by the window lights. And then this is our counselor room, where we have digital printouts of digital reports can also be given, but also we have to give paper printouts and maintain paper files, because those are seen when the NMC or NABH people come for the rounds. Then we have the ultrasound light room. And then this was the andrology area. Where again we are following all the waste, biomedical waste
Segregation.
procedures. Yes, segregations. So then this is the lab area where I'll ask my embryologist. He'll take from this and show inside.
Good afternoon, everyone. This is the scrotum.
Here, Dr. Minu. So that chair issue is still there, but we are now covering it during the procedures with a green sheet. And this is the laminar OT.
क्रायो कैन्स अभी भी मगर वैसे ही मूव करते हो आप ऑल द वे।
वो चीज को बस अब इतना डॉक्टर सॉरी बीच में डिस्कनेक्ट हो रहा है। आई कम आउटसाइड द लैब। एक्चुअली क्रायो कैन का the only thing that he has done till now is he is using proper thermocol boxes which are fully covered, which are fully closed, so that the loss of LN2 is minimum.
आपका डिजिटल फुटप्रिंट थोड़ा बड़ा है कि नहीं बड़ा है, या अभी भी पेपर का कंजम्पशन उतना ही है आपका डॉक्टर रुचिका?
पेपर कंजम्पशन दैट इज व्हाट आई हैड टोल्ड कि पेपर कंजम्पशन हम नहीं वो कर पा रहे हैं। थोड़ा तो डिजिटल है हमारा कि रिपोर्ट्स हमारी ऑनलाइन है, हमारा पूरा का पूरा
कैप भी आपके भी डिस्पोजेबल ही है।
हाँ, ये अभी हमारी वो नहीं हुई है। और जो पेपर का वही इशू मैं बता रही हूँ आपको कि कंसेंट्स के साथ जो हमें एक फाइल मेंटेन करनी है विच इज अराउंड 12 to 15 पेजेस ऑफ अ फाइल, जिसमें कंसेंट्स हैं, हिस्ट्री शीट है, क्लिनिकल नोट्स हैं, प्रोसीजर नोट्स हैं, ट्रीटमेंट शीट है, एक दो पीछे मेडिकेशन शीट इनपुट, जो एक प्रॉपर एक फाइल मेंटेन होती है लाइक इन अ मेडिकल कॉलेज, वो उतनी हमें 12 to 15 पेजेस की फाइल मेंटेन करनी पड़ रही है।
ओके,
वो चीज हम थोड़ा सा अवॉइड नहीं कर पा रहे हैं।
आप रिपोर्ट्स पे कट डाउन कर दो, मतलब जो चीज कर सकते हो जो
हाँ, रिपोर्ट्स हमारी है डिजिटल, तो हम उसी में
हाँ।
वो कर देते हैं, चार्ट आउट कर देते हैं।
लैब रिपोर्ट्स भी और
हाँ
IVF की
मैम,
डिटेल्स भी है ना, वो
उनके
सारे।
प्रिंट आउट्स नहीं निकाल रहे, उनको हम फाइल में ही चार्ट कर दे रहे हैं।
क्योंकि इंडोर का तो वो बहुत लंबा चौड़ा काम रहता है, NABH का, दैट आई एम नोवेयर।
जी जी मैम, जी मैम।
तो जो ये अब कैप मास्क का भी यू सिंस यू आर पार्ट ऑफ अ बिगर मैनेजमेंट, उसमें ही हिच आ रहा है कि क्या आ रहा है?
जी मैम, वही हिच है, जबकि हमारी मैनेजमेंट मैम बहुत ज्यादा प्रोएक्टिव और वो
आपने
है
बताया था। हाँ,
कि सोलर पैनल्स हैं जो कि मैम 2 मेगावाट्स ऑफ एनर्जी जनरेट कर रहे हैं पर मंथ, एंड पूरा रेन वाटर हार्वेस्टिंग कंप्लीटली है, एंड वी हैव अ प्लास्टिक रिसाइक्लेबल प्लांट ऑल्सो। हमारे अंदर हॉस्पिटल की जितनी प्लास्टिक जनरेट होती है, एक पुनर करके मैम हमारी अपनी ऑर्गेनाइजेशन का वो है पार्ट है, जिसमें वो सारी प्लास्टिक से बैग्स बन रहे हैं, तो वो पूरा का पूरा।
पिछली बार हमें नहीं बताया, ये बहुत अच्छा पॉइंट है।
हाँ जी मैम, वो पूरा का
रियली गुड थिंग्स, यानी मेजर थिंग्स जहां पर वेस्ट वाटर रिसाइकलिंग, रेन वाटर हार्वेस्टिंग, वेस्ट वाटर रिसाइकलिंग एंड प्लास्टिक रिसाइकलिंग, दिस इज रियली गुड।
प्लास्टिक शी डिडंट टेल अस लास्ट टाइम, बट रेन वाटर और वो तो बताया था, सोलर।
हाँ जी मैम, प्लास्टिक का पूरा पुनर करके हमारा एक वो है, एक साइड वो उनका, क्योंकि हमारी मैनेजमेंट उस चीज में बिलीव करती है कि हर चीज हम अपने आप से ही वो करें, क्रिएट करें और अपने आप ही उसको रिसाइकल और रीयूज करें।
इकोनॉमी,
तो मेड इन इंडिया कॉन्सेप्ट भी आ जाता है उसमें काफी।
मैम ट्री प्लांटेशन भी करते हैं, तो उसका भी पूरा का पूरा उनका वो है कि एवरी ईयर दे विल प्लांट ट्रीज, और वो काफी सालों से तो बड़े बड़े ट्रीज हो गए हैं, तो वो पूरा उस तरह से मैनेजमेंट वो करती है।
So maybe if you can just push them a little bit for these disposable caps and masks. I'm
जी
sure
मैम।
if they are already
हाँ
sensitive to this issue, so they will definitely, I think, agree to your proposal. है ना?
ठीक है मैम, ये पॉइंट
है ना?
हम ये
और
वो
वो
करके।
मेड इन इंडिया वगैरह वाला भी, वो आई थिंक ESG क्रेडेंशियल्स, मेड इन इंडिया, वो सभी को थोड़ा सा देखना पड़ेगा।
ये सब मैम, ये
अ,
हमें अपने वेंडर से बात करनी पड़ेगी मैम इस चीज के लिए।
हम्म,
हम एक बार फॉलो करते हैं उनको।
जी।
जी मैम।
और SOPs आपने बना लिए हैं अभी? कुछ कुछ तो बना दिए, मीडिया ऑर्डर
जी मैम।
कंजम्पशन वगैरह
जी
वाले।
मैम, एसओपीस हमारे थे भी, और हमने जो पर पेशेंट वाला वो है वो किया है हमारा। हर मंथ के स्टार्ट और मंथ के एंड में हम अपने पूरा कंज्यूमेबल्स और नॉन कंज्यूमेबल्स का रजिस्टर मेंटेन करके रखते हैं मैम, कि कितने हमने ऑर्डर
इसमें
किए
कुछ
और कौन
रिडक्शन
सी।
आया आपका
मैम
मीडिया
अभी
में,
उतना नहीं
कंज्यूमेबल्स
आया
में?
मैम, अभी मोरलेस सेम ही है हमारा, कंजम्पशन में वो नहीं आया उसको।
पर पेशेंट के हिसाब से इफ यू कैलकुलेट द नंबर ऑफ
मैम पर पेशेंट के हिसाब से सिग्निफिकेंट वो नहीं है मैम, इट इज नॉट अ सिग्निफिकेंट डिफरेंस। लेकिन मैम कोशिश है कि वो चीज थिंकिंग में आ गई है कि यस वी हैव टू मेंटेन दैट रिकॉर्ड, एंड उसी को अब हम फॉलो करेंगे कि पहले से, क्योंकि पहले पर पेशेंट रिकॉर्ड नहीं मेंटेन कर रहे थे, तो अब कंपेयर करेंगे उस चीज को कि अब हम कितना रिड्यूस कर पा रहे हैं।
और ओवरऑल कंजम्पशन भी, से फॉर 50 केसेस व्हाट वाज योर कंजम्पशन? अगर पर पेशेंट नहीं हो पाता है तो
जी
बल्क
मैम।
वाला।
हाँ जी मैम, मंथ उसका।
Per month, or
बाकी
has
maybe
not been
per 50 cases would be better, because monthly sometimes festival season, shadi season, तो number keeps
number
going
of
up and down,
cases.
है ना? So per 50 cases or per 100 cases का कुछ ऐसा calculation मेरे ख्याल से would be better.
जी 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 मैम।
So you have not been able yet to club your embryo transfers?
Ma'am, as such, this being a part of a big medical college, IVF is a unit in this medical college. तो इतने लार्ज नंबर्स हमारे यहाँ नहीं होते हैं आईवीएफ के। लेकिन मैम, एक अगर हमारा एक दिन की तरफ हो रहा है तो फिर हम एक ही साथ क्लब करेंगे, वरना हम इंडिविजुअलाइज्ड अप्रोच करके ही चलते हैं कि एज पर द पेशेंट ईटी जो उसकी है उसके हिसाब से ट्रांसफर प्लान करते हैं। अगर हमारे एक दिन में ज्यादा ट्रांसफर्स हैं तब तो फिर मैम एक ही साथ करेंगे, लेकिन हाँ
बाकी ये
पूरा
भी है कि
बैच
sometimes,
बैच आईवीएफ नहीं करते मैम।
हाँ बैचिंग तो नहीं, बट देन
हाँ
विच टाइम ऑफ द डे, एक ही
हाँ
बारी में
मैम,
सारे,
वो मैम,
that is
यस
one
मैम,
thing.
यस मैम,
And
यस
secondly,
मैम।
also sometimes you can give 1 or 2 days more, so maybe you can identify certain days of the week where you would preferably do it, है ना? अब now that we are doing some natural cycles, stimulated cycles, ET, तो वो भी उसमें एक flexibility कम हो गई है ना?
जी
But
मैम, जी
HRT
मैम,
cycles में तो थोड़ा आगे पीछे
थोड़ा।
किया जा
जी
सकता है।
मैम। जी जी
चलो
मैम।
ठीक है जी।
जी मैम।
Anything else, Dr.
अब
Bindu? Dr.
I
Meenu?
think that's fine. Yeah.
है ना?
जी
बाकी तो वो जो क्वांटिफिकेशन वाला, तो फिर then we'll make some kind
Yeah.
of a
Yes.
list and protocol for everyone, and then we'll circulate it.
Yeah. So
जी जी
now, like Sir said, we have been. This is all very subjective. Certain parameters that can be objectively calculated, we can do that. Quantifiable parameters we'll share.
Yeah,
जी मैम। जी
ठीक है।
ठीक।
Dr.
ठीक,
Sarab,
थैंक यू मैम।
thank you so much, Dr. Ruchika.
थैंक यू मैम, थैंक यू
Thank you, Dr. Ruchika.
मैम।
Dr. Sarabpreet. Dr. Sarabpreet.
Looks like he's not there.
Yeah, I thought I have lost contact or what, but
Nahi.
maybe I'll try to call him up and
He's
ask.
still there as a participant visible. Maybe he got occupied somewhere.
I'm just calling him up.
Yeah.
Yeah, so he's just there. He was on another call, so now he'll start.
डॉक्टर मीनू मैं क्या निकल जाऊं?
सर बस लास्ट है अभी डॉक्टर सरबजीत का.
And his was always quite complete.
Yeah.
Hello.
Good afternoon.
Good afternoon, Dr. Sarabpreet.
So, how do I go? I have, I think, shown you everything, but you just guide me. How do I begin? I mean,
Since
now
sir was not there
Yeah.
last time and he's there, maybe you can just show around. We have seen all of this last time and we got very impressed with it also.
Yeah, I'll start with the entrance actually. So this is how we enter, and this is our counseling room. It's a small room. And then this is a utility, and this is the andrology. Then we have the procedure room, reception, a semen collection room, which is like quite dark. This is the consultation room. This is good lighted. I mean, हमने अभी curtains गिराए हुए हैं. Still, it is well lighted. We don't switch on the light. And this is where I sit. This is also well lighted. I just had my lunch 5 minutes back. So this is our storage area. This one is mainly cryobiology lab with storage. And here also you can see there is no need of switching on any light. There is, we cut the other room short to have good light in this room, and there everything is nicely arranged. So this is a laminar where we do the basic cryobiology stuff. And I'll now take you to the IVF lab. This is a change room. Pinky, इसका एक signage बनाओ ना change room का यहाँ पे. This is the IVF lab, this scrub station. This is a menu.
Sorry, sir, just 1 minute. I saw disposable caps in your changing room.
Yeah, वो थोड़ा लोग मानते नहीं हैं, अब क्या करें, अपना ही
He
कर.
was mentioning कि लोग मान नहीं रहे हैं. And like I said, हमारे यहाँ लोग mask के लिए they kind of resist and they are unhappy कि mask तो disposable दे दो. So I guess you can't do everything.
मतलब
Even if you wish.
I wear my dress for almost 10 odd days. I tell them not to, do it because they hardly wear it for an hour or so. But they just, I mean, वो आदत पड़ी हुई है ना, कितना भी बोल लो, but they'll just
हाँ,
discard
पर
and go.
बार-बार बोलने से फर्क तो पड़ता है.
हाँ, बोल तो रहे हैं,
बार-बार
but then
बोलने
they
से.
say कि हमें कैसे पता चलेगा, because if you look at my this thing, my this is, I've got the buttons on this. So अब मेरा तो अलग से पड़ा रहता है, इनका सबका mix हो जाता है, and they don't want that. So they have their own reasons, but we will kind of mark them in some way or the other. So we just completed, today was a heavy day for us. Junior embryologist is still working in the lab, he's cleaning things. I'll just show around the lab. So these are a couple of incubators, laminar. We've got 2 stereo. We've got
Last
a
time you
small
had
bench.
shown us your smart switches.
Sorry?
You had those smart switches, no? Which just go.
Smart switches नहीं थे ना, numbering की हुई थी.
Yeah, yeah.
अच्छा, numbering वाले switches थे.
Numbering था, मैंने सारे on किए to have good light to show you around. मैंने सारे on कर दिए. But we have numbered them, so as per the procedure, we have a common language and कि किसको on करना. So this is a case system. We have got 2 ICSI machines also. And then there's a small area in between. This is only for a couple of containers of embryology lab. The rest, whatever is outside in the cryobiology lab, it is mainly the mainly embryology, and some embryology also is there, but mainly जो 1-2 साल की freezing वाले हैं वो सब हमने यहाँ रखे हुए हैं. This is another entrance to the same area. We have to tidy it up. काफी दिन से पेंडिंग ही चल रहा, हो नहीं पा रहा.
दिवाली तो आके चली गई.
दिवाली नहीं, actually there was a
center
laminar inside, if you recall. So na, there was a laminar inside if you recall earlier, na, there was a laminar hood inside. I don't think whether you can recall it or not. Now we got it shifted a couple of days ago, and then I was not there for 2 days. मैं आज सुबह आया हूँ. तभी आज वो हमारे 4-5 केस भी थे. So this laminar has come out now. This was inside in the lab earlier. So वो थोड़ा सा ना मतलब हैफेजर्ड हो गया. We have to organize, and without my presence होगा नहीं वो. तो हम 1-2 दिन में कर लेंगे इसको. It's not a major task for us. We will do it. That's the only thing which I thought that nobody will notice, but Dr. Meenu ने notice कर ही लिया.
पिछली बार आपका सेंटर बहुत स्पार्कलिंग लग रहा था. इस बार लग रहा है खूब काम हो रहा है.
तो स्मार्ट हो गया, पहले तो नहीं था. We have, like, with the help of our management, we have
Sir, I
made it
think
into
you've been busy, तो I think उसमें तो ऊपर नीचे हो जाता है. You just wound up a busy day.
नहीं, आज बहुत busy था. आज I was not there for 2 days, तो वो कुछ cases club हो गए थे.
No
So,
greenwashing.
that's why. Sorry?
Greenwashing हो गया ये. No one would notice, but
हाँ.
दिख गया. That's fine.
अब देखो, मैंने तो plants भी लगाए हैं अपने रूम में, इतने अच्छे सुंदर. So we are trying to keep it green as much as we can.
ठीक है, I think the whole thing now boils down to whatever changes we have been trying to incorporate, most of them, everyone is trying.
मैम, I think ना
quantification है जरूरी.
हाँ, quantification. और मैम बिल्स मांगने पड़ेंगे.
Bills.
Whatever, like electricity और quantification of media, consumables, paper.
So even if
जो भी मतलब quantifiable चीज है उसमें उसका नंबर.
I think multi speciality भी है. कुछ ना कुछ करके बिल तो दे दो, देखते हैं उसमें से क्या कर सकते हैं, है ना.
मल्टी स्पेशलिटी में ना डिपार्टमेंट वाइज नहीं आएगा ना बिल.
राइट.
हाँ, बिल्स तो नहीं हो सकते हैं. बिल्स तो मैंने पूछा था इनसे, तो they don't have a separate gauge to kind of see the bills of a particular department.
So
Common ही
maybe
रहता है
just
floors का ना, floors का
quantification of media and disposables per patient or per 50 patients, something like that, है ना.
मैम आप जल्दी से ना मैम सर से पूछ लो सर का क्या इनपुट है, फिर सर से हम सिनॉप्सिस फिर बाद में क्रिएट कर लेंगे. नहीं तो सर से मिलना जाता है. एक बार सर बता दो what is your
ना. हमने जो भी करा है, this is all hypothetical. Great job done, good beginning, but nowhere I could see any objectivity. हमको अगर देखो अभी तो समय कम है, and we just began the journey ना. हमेशा every journey starts like this only, so it's a great job done. But I think when you guys take it over a period of 1 year, it should be all very, very objective. We should have some numerical. We should have some sort of KPIs of what we have done. There are no KPIs involved here. So we don't know. We're just going by spotting a mass there, just going by a lot of labs had wooden furniture there. I saw some of the labs had broken chairs, but there were leaking, foam is coming out. कहीं पे बहुत dirt दिखा मेरे को. Just we are having a different sort of conversation. But important here is that we need to have something called KPIs, and KPIs can be created amongst ourselves. There are no KPIs for lab health. 3-4 KPI lab health in terms of green health. We call it a green health KPIs. And we should have some KPIs. या 2-3 ही KPI बनाओ. But KPIs को बनाकर ही हम आगे बढ़ पाएंगे अगर हमको इस चीज को अच्छे जगह प्रेजेंट करना है तो. Otherwise, we're only doing it कि अभी अच्छा लग रहा है पहले से. अभी पहले से बेटर है, तो वो चीज हम कहीं प्रेजेंट नहीं कर सकते. So I think just from my side is that अभी तो चलते हैं, बहुत अच्छा हुआ सब कुछ, and we have done a good job. अभी जो हम अगर मेरे को देखो तो एक ही KPI अचीव हुआ है हमारा नेट अवेयरनेस का. That's only KPI which we have availed. But I can't see any, और हो भी नहीं सकता, कैसे
क्वांटिफिकेशन
होगा?
करना मुश्किल हो रहा है।
कैसे होगा? हो भी नहीं सकता ना। We cannot do magic बैठे बिठाए. We cannot do it. It takes time. So I think I must congratulate Sarabpreet, Ruchika, Vishwadeep, and everyone who are there who've done a great job. It's a great job done. But I think later on as we move ahead, we'll take help of Sarabpreet to design some KPIs in embryology health, green health. Others can design KPIs for. वो बनाना पड़ेगा हमको. We have to have KPIs. But very well done. But now I've told you how we are moving ahead, and that's all from my side. अभी भी कहीं पर भी मेरे को प्रॉपर बायोमेडिकल वेस्ट डिस्पोजल नहीं दिखा किसी भी जगह पे, एक जगह को छोड़ के. There were no yellow, then black and red bins. I couldn't see it also.
नहीं सर, वो तो थे,
सर वो सब में
वो वो सब में थे।
अच्छा, मुझे शायद दिखे नहीं। तो अभी जैसा भी है, but that's okay. That's one KPI ना, तो KPI बन गया ना हमारा. That's a KPI. So we have to have that KPI marking है कि नहीं है चीज को. तो फिर इसको देख लीजिए अगर कर सकते हैं तो. Nothing. Wood has to go. अभी बहुत जगह पे wood दिख रही है मेरे को लैब्स के अंदर, लकड़ी दिख रही है, तो वो नहीं होनी चाहिए उसके अंदर.
Sir,
well done,
but
yeah.
having wooden stuff in the lab is मतलब greening के how is it related to the greening of the lab?
बोर्ड होते हैं ना, लकड़ी
Even
के बोर्ड
otherwise
होते
we
हैं.
don't need.
नहीं, I know they should not be there. VOCs release हो रहे हैं, तो it's not good for the lab as such. It's not good for the oocytes and the gametes and the embryos. But I mean, I don't think we can even expect कि वो they will remove all those things and put in other, है
नहीं,
ना?
मैं
वो तो
नहीं
हो
कह
नहीं
रहा कि
पाएगा।
निकालना है. देखो, हम एक जर्नल में यहाँ तक तो पहुंचे कि we are all sitting together and talking about it. See, I'm not saying that we can remove our doors. हम ऐसा नहीं बोल रहे हैं. I'm just saying कि वो doors नहीं होने चाहिए. तो
हाँ,
doors है
that
तो
is
फिर
true.
KPI के अंदर देखो, कहीं ना कहीं तो हमको एक मार्किंग तो करनी है ना. मार्किंग इज नॉट डन ऑन इमोशंस.
बेंचमार्क तो रखना है ना.
Marking is not done on emotions. Marking is done on numbers always, good or bad. So I think we have done a great job here. यहाँ तक पहुंचना आसान. You guys have done an impossible job. You made a team of 80 people, 90 people who are thinking alike. I think it's a super job done, and the whole team. Super job done. And I must compliment Lavleen and Bindu Chamotan. It's a great job done. And all the team leaders. Now it's the time. Try to find out. मैं निकलूं, डॉक्टर भारती का फोन आ रहा है बार बार से. आई एम लिविंग. यू गाइस कैरी ऑन. वेल डन, वेल डन. शाबाश, शाबाश. हाँ जी भारती मैम.
बाय सर.
हाँ जी मैम, हाँ जी मैम. हाँ जी.
नवलीन मैम, और कुछ और है पेंडिंग हमारी तरफ से, और डू वी कॉल इट अ डे?
नहीं, आई थिंक वी कॉल इट अ डे एंड देन डॉक्टर बिंदु और हम तीनों बैठ के एक बार सोच लेते हैं कि क्या क्या हमने क्वांटिफिकेशन किस किस चीज की मांगनी है, और केपीआईज के लिए तो सबको दिमाग लगाना पड़ेगा.
वो तो आई थिंक बाद का काम है. सर ने जनरली बोला है कि भी आगे जाके एक साल अगर हम
हम्म,
प्लान में इसको कंटिन्यू रखते हैं तो आई थिंक अभी तो मैम सिर्फ जितना ऑब्जेक्टिफाई कर सकते हैं उतना ऑब्जेक्टिफाई कर लेते हैं इन चीजों को, पैरामीटर्स को. मुझे
which includes electricity, water, diesel, if कुछ है
जो जो
ये
सेंटर
तो.
दे सकते हैं मैम वो दे दें, जो
हाँ,
नहीं दे सकते तो
नहीं
वो
तो
तो भी रिस्ट्रिक्शन है
एटलीस्ट
ही है.
LN2 और
Rent to consumption, media consumption, consumable
मीडिया,
consumption,
हाँ,
paper consumption,
डिस्पोजेबल.
electricity, बायो वेस्ट में भी मैम उनका कितना जा रहा है, क्या सेग्रीगेशन से उनका जनरली बल्क कम हुआ है, ये भी तो एक एंगल देख सकते हैं ना वो.
हम्म,
तो ये सारी चीजें जो पॉइंटर्स कॉन्क्रीट दे सकते हैं वो कॉन्क्रीट दे दें, वो तब फिर उस तरह से उसको
बहुत बहुत ज्यादा नहीं मांगे मेरे ख्याल से. वी
मैम ये
कैन
ज्यादा
हैव
नहीं है. 10
5 or
10
6.
पॉइंट 10 पॉइंट बनेंगे, ज्यादा
10
नहीं
पॉइंट बने,
है.
हाँ, 10 इज ओके.
हम्म.
ठीक है. So per 50 patients or something we can have media disposables, and बाकी LN2 diesel, electricity, water, whatever available, paper, ये per month हो जाएगा, है ना. और कार्बन फुटप्रिंट की तो कोई सर से बात हुई नहीं.
वो कार्बन कैलकुलेटर वाला जो कह रहे थे आप.
हाँ, कार्बन
अब
फुटप्रिंट का
मैम ने
पता नहीं.
सर ने जब लास्ट टाइम जो मुझे 2 मिनट बोला था तो यही आपको भी बताया था मैंने कि
हाँ,
कि अभी ऑब्वियसली कमर्शियली नहीं करने की जरूरत है, ऑनलाइन ढूंढो. अब ऑनलाइन मैम कौन सा यूज करें, कैसे करें, वो भी एक पैरामीटर है. तो वो
ऐसे तो
बात
कुछ
करनी
समझ
पड़ेगी
नहीं आता
मैम.
उसमें कैसे करना है ऑनलाइन वाला ना.
या तो मैम जिनको आप जानते हैं उनको कहो कि कोई एक ऑनलाइन सजेस्ट कर दें. वो अगर हमें इजी फीजिबल लगता है तो वो हर सेंटर अपना अप्लाई कर ले। जैसे सर ने एक बार अपने टॉक में क्या बोला था कि एक कार्बन कैलकुलेटर घर, जैसे घर के लिए है कि आपकी लैपटॉप कितना यूजर है, आपका बिजली का बिल कितना है, एक बार सर ने ये कोट किया था। तो उससे आप अपना अपने घर का आप निकाल पा रहे हो कि मैं कितना फिलहाल यूज कर रहा हूँ। बट ये है कि प्री और पोस्ट में इनको फिर इलेक्ट्रिसिटी बिल, वाटर बिल, वो सारी चीजें भी तो चाहिए होंगी।
हम्म
जो उसमें आप डालोगे तभी तो वो उसको आउटकम भी आपको बताएगा ना कि कुछ रिडक्शन है या नहीं आपके फुटप्रिंट में। तो उसके लिए ये वाले पैरामीटर्स तो चाहिए होंगे।
हम्म
सो ये करना मैम, इसके थोड़ा सा मतलब बैकएंड में काम करना पड़ेगा। ये बस ये कुछ एक चीज है, ज्यादा
चलो एक बार
नहीं।
फिर से
हाँ
कोशिश करते हैं।
हाँ, ठीक है मैम,
मैं
डन।
तो अभी भी डाल रही थी तो वो यही बोलता है, देयर इज नो सिंगल स्पेशलाइज्ड कार्बन फुटप्रिंट कैलकुलेटर डिजाइन्ड एक्सक्लूसिवली फॉर एन आईवीएफ लैब. However, it can be calculated by using general business or laboratory specific tools and applying relevant
हाँ,
emission factors.
तो वो वाला है, कुछ ऐसे ही यूज करना पड़ेगा मैम। स्पेसिफिक टू आईवीएफ नहीं होगा, मे बी टू लैब्स हो सकता है।
वही हम लोग बात कर रहे थे एक्चुअली। स्कोप 1 स्कोप 2 तो हो जाता है, स्कोप 3 का तो बहुत ही मुश्किल काम है ना।
मुश्किल है।
क्योंकि कितने पेशेंट्स आ रहे हैं, उनकी कितनी विजिट्स हो रही हैं, वो मतलब राइट फ्रॉम how you give duties to your staff, how many people are being
या
employed, और
या
बहुत
फिर
सारा
मैम
कुछ हो जाता
बॉल
है।
पार्क एक कार्बन फुटप्रिंट हम रफली, मतलब अभी इट कांट बी अ प्रिसाइज फिगर, बट इफ वी जस्ट गिव एन एवरेज कि मतलब प्री
हम्म
इंटरवेंशन पोस्ट इंटरवेंशन कुछ किया, और वो तो उसी पे डिपेंड करेगा ना मैम कि हमारा इलेक्ट्रिसिटी कंजम्पशन कम हुआ, हमारा सारी मीडिया कंजम्पशन, पेपर कंजम्पशन, वो सारा ही तो
हाँ मतलब
कंट्रीब्यूट करेगा ना
वो
इवेंचुअली।
वो अगर वो भी हो जाता है ना, if we can have that, I think that itself can be can show that okay, some change has been made.
हम्म, ठीक है मैम, आई थिंक ये इस पे
चलो
काम कर लेंगे मैम।
चलो
ये
ठीक
टेन
है जी।
फिफ्टीन डेज के
Actually,
अंदर अंदर ही करेंगे मैम।
sir is not too happy.
हम्म
But
It's all right, ma'am. But as he said, no, it is just the first time we are all doing it.
yeah, and see, for everyone to understand the concept in अभी भी देखो इतना बोलने के बाद भी
But
I'm
what
not
is
sure.
his input is also important for the fact that we can't leave it as subjective. Let's
Yes,
give it something
yes.
more
yes
concrete in terms
नहीं
of
एब्सोल्युटली, इसमें से
हाँ
जो भी
हाँ,
क्वांटिफाई हो सकता है हम
कर
करेंगे।
देते हैं, वो कर देते हैं। ठीक है
पर
मैम।
बस आई थिंक क्वांटिफाई करने का कर लेते हैं। मे बी लेटर इन द इवनिंग डॉक्टर बिंदु, हम दोनों बात करके देखते हैं, है ना।
यस यस यस,
फिर मीनू
एक
से
लिस्ट बना लेंगे, एक लिस्ट बना लेंगे
पहले
और
हम दोनों कर लेते हैं, फिर मीनू से कम्युनिकेट कर लेंगे, फिर सर्कुलेट कर देंगे।
ठीक, बिल्कुल।
ओके
ठीक है जी।
मैम।
ठीक,
चलो ओके डॉक्टर
थैंक यू
मीनू।
सरप्रीत सर, बाय डॉक्टर
थैंक
रुचिका,
यू
बाय
एवरीवन।
बाय बाय एवरीवन।
बाय मैम,
बाय
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 बाय मैम, बाय लवलीन मैम।
बाय।
बाय बाय।
सुनीता। हेलो। गुड आफ्टरनून रितु।
हेलो, यस मैम।
हेलो।
हेलो, यस मैम।
कौन बोल रहा है? मैंने
मैम,
डॉक्टर रितु को रितु
मैम
अग्रवाल
हिमांशु,
को कॉल की थी।
मैम हिमांशु बोल रहा हूँ मैम।
नहीं, आपसे तो गलत लग गया नंबर, मैं तो किसी और को कॉल कर रही थी, प्लीज।
मैम मैं जूम मीटिंग में हूँ, आप जूम ज्वाइन हो। हेलो।
हेलो।
हेलो, यस मैम।
आप बंद कर दीजिए कॉल, आपसे तो गलती से लग गई है मेरा ख्याल कॉल। आप कौन, हिमांशु?
मैम हिमांशु फ्रॉम कॉन्फ्रेंस हिमांशु।
अच्छा। मैंने तो उसको
मैम
श्रेयसी को
आप
नंबर
जूम
लगाया
ज्वाइन
था।
हो, जूम ज्वाइन हो मैम आप अभी।
ओके, वो कहाँ से हो गया?
एक बार देखो, आपका पीछे से जूम एप्लीकेशन खुला हो।
हाँ हाँ हाँ। अच्छा चलो, मैं क्लोज करती हूँ। आई थिंक दिस वाज समवेयर माय मिस्टेक। आई एम जस्ट क्लोजिंग।